So another important and useful way we can treat the gluteal muscles, we have the gluteus medius and we have the gluteus minimus that are so lateral. Sometimes it's easier to actually palpate these from sideline position. So we're going to place our client in a sideline position as so, and we're going to drape through the legs to expose the entire glute medius and minimus area. So the bony landmarks that are important to find here are going to be the greater trochanter of the femur, which is located right here, and the ASIS. And in this position, it's going to be located right here. So the gluteus medius is going to be the most anterior and the largest of these two muscles. And deep to it is the gluteus minimus. So in this position, we're actually going to use stacked fingers to follow and trace this muscle towards that bony landmark, the ASIS. So we're going to do some deep stripping effleurage in this position. I feel it's trigger point or something right there. Is there any referral on that?
No referral, just local.
Okay, we're just going to hold there for a second. And if you feel it start to let up, we'll do a little bit of gentle friction. These muscles very commonly have trigger points that refer down into the leg. So sometimes some of those sciatic symptoms can actually come from gluteus medius and minimus. Medius typically refers pain up towards the low back, and minimus is the culprit that very much acts a lot like sciatica. So much so that it was nicknamed pseudo-sciatica. So in this area, we can actually do just a little bit of petrissage too to make nice to the tissue after all that deep stripping, and go back to treat with some forearm and elbow compression. And because of the angle of sideline, you can actually get in there a little bit deeper than you can get to this from the supine, or I'm sorry, from the prone position. Alright, and after this area has thoroughly been treated, we're going to redrape her and have her turn, we're going to have her turn into a supine position. So we're going to finish with a stretch for the lateral rotators. And this is a modified pigeon, and there are a couple different variations of this exercise depending on your client's flexibility. So we're going to start with the unaffected leg, the leg that we have not been treating, in a bent knee position. We're going to have the affected or treated leg in a straightened position. Client is going to need to be fully clothed for the stretch. So we're going to lift the leg, bend the knee, and we have a little bit of restriction here. So we are going to rest this ankle on the unaffected knee, and we're going to just gently apply a little bit of pressure to the inside of the knee to the client's tension. Will you tell me when we get to that barrier of tension?
About there.
Okay. And we're going to hold this for about 15 seconds or a couple of nice slow deep breaths. And when you're ready, you can slowly ease out of the stretch, reducing the tension, bringing the knee back to neutral, and returning the foot and ankle to the table. So we're going to explore what's going on in her opposite side to see if we have any differences in the range of motion. So we're going to try that stretch again on the other side to see if maybe we'll be able to go a little bit further. So once again, I'm going to lift her leg over her knee. And we've got a little bit more range over here. And if you're able to do this with both hips still on the table, so you want to make sure the whole sacrum is on the table. If they start to come up and roll off the table with one side, you want to back that off. We're actually going to lift the foot and bring it in for a really deep lateral rotator stretch. We couldn't do this on the other side. Tell me when?
That's it.
Okay. And we're going to hold here. And slowly bringing it back down. All right, and that's it.